Now, you've met Christian yesterday. He's the CEO of BioMed and BioRN Cluster Management, and he was instrumental in the development and implementation of the economic growth strategy for BioRN, which was recognized as one of the 5 strongest high-tech regions in Germany in the leading edge cluster competition. Christian, the floor is yours. Yes, sure.
Thank you very much, Joanne. I need to move around. So you've seen in the presentation of Ottmar Wiesler that there is this gap between academia and industry, especially in this pipeline where you move from preclinical to clinical. And this is actually something where we've created a new innovation model to bridge this gap. And I'm going to tell you a little bit about it. As a bottom line, the pharma industry is in big trouble. This is a piece of research that actually looked at how many drugs could you develop and bring to the market for $1 billion? And this is inflation adjusted. And it's looking at the last 60 years. And if you look at 1950, that was enough for around 50 drugs. And if you look, you've seen Adrian Carter's slides yesterday. Today it takes on average $2.6 billion to do one drug. So today is not even half a drug. So in these 60 years, you have a decline of innovation productivity of a factor of 100. And this is obviously a problem. And there is another problem. As compared to a situation 30 years ago, today every bright talent in the world can freely choose where he or she wants to pursue her most creative years. So on one hand, we have this mobile global brain power, and if you look at in biomedicine at our major publication database, you will find 11 million individual authors, and this is an exponential curve. So 1 million new authors are joining each year. And on the other side, you have this little brain of pharma companies with most of the time a couple of thousand researchers only. So for them, it's really clear, no matter how big you are, over 99% of the global brain power is always outside of your company walls. So how do you get access? And we've developed a model that actually helps to find the needle in the haystack, but basically turning it upside down through crowdsourcing and make the best solutions come to you. And this works in a way that with pharma companies, we are basically formulating very tough challenges for which the pharma companies have no clever solution. And we post those challenges worldwide at the best universities and research institutions and invite young researchers, mostly postdocs, to apply with a very clever solution to the problem. A project proposal. And then the next step is actually, usually we get between 300 and 600 of such proposals, and the next step is that we identify the 15 most promising candidates, and we invite them for a 5-day boot camp to Heidelberg. We fly them in, pay for everything, and put them in this boot camp. We don't let them sleep for 4 nights. We add mentorship, we put them in groups that don't know each other, and help them to convert this collection of sometimes really crazy ideas into something we would call a fully fledged project proposal. And then on the last day, they present in front of the grand jury, including the top management of the company, and the winning team wins a 2 to 4 year research fellowship at my innovation center. So we move the families to Heidelberg by organizing visa, new houses, jobs for the spouses, kindergarten spots, whatever they need to be happy in Heidelberg, and they live and work in my Open Innovation Center, which is a private company. It works like an institute, but it's a private company. I'm the only owner. There is no venture capital and no public funding involved. This is an example of the metrics of such a bootcamp. You've seen the presentation of Adrian Carter yesterday, and he's mentioned this group, this process we had together. The question here was identify completely new drug targets at this interface between COPD, so lung diseases, and epigenetics. And we had 328 applications from 59 countries. Every one of them applied with a very original project proposal. They go across nationalities, they go across gender, they go across different levels, group leaders, postdocs, and assistants. Then we invited 17 candidates selected from 8 countries to this boot camp. They all survived. It was pretty tough, but they all survived. And in the end, 3 candidates were invited to join BioMed, and we moved their families to Heidelberg. This is the type of atmosphere you get at one of the earlier days during the boot camp. The later days, since they're not sleeping, they look a little more tired than that. But it's also a group experience. And this is the photo you saw yesterday on Adrian Carter's presentation. This is the group that came. In the middle you see Renata, who's the group leader, and actually she started the project 9 months pregnant. You can see that, and something like this also works at BioMed. And we have yesterday we had this gender topic, and on the panel, over 50% of our researchers are female. 3 of the 6 group leaders are female. 1 of the 2 managing directors is female. So we don't have quota, but we take simply the best. We don't care about gender, and luckily it's 50-50, or even a little more female than male. This is the type of projects we're doing. These are all preclinical research. We have 5 different pharma companies signed up so far. Every one of these projects has a budget between 3 and 4 million euros, which is financed by the pharma companies AbbVie, Boehringer Ingelheim, Johnson & Johnson, Merck, and Roche. And the topics go from neurosciences. So with AbbVie, we have something in Alzheimer's disease. Boehringer, the gray ones, by the way, are the ones that are just coming on board this summer. The red ones are already at BioMed. So we have, at the moment, we have around 60 researchers from around the world, and we'll be over 80 by third quarter this year, and I think we'll crack the 100 this year. The whole thing was started 2013 in August. We're going through cancer. Now we have oral biofilm disruption. That's a consumer health topic. How do you put something in your Listerine that will provide you something where you don't have to brush your teeth anymore? You just rinse your mouth once a month, that's enough. It's really challenging questions. And from Roche, we have a challenge about the diagnostic of the future. The call was come up with something that actually will cost a cent to produce, will be disposable, and will integrate from sample preparation through sensing, through signal processing, and you will get all of this for all different analytes. And so we have a very clever group leader who does that. Can we attract top people from the top institutions? This was the question when we started it, and yes, we can. We have 2 group leaders from the Whitehead Institute, MIT Boston, one from University of British Columbia, one from Georgia Tech. We have people from all top institutions, including German Cancer Research Center, and I think we are very well integrated in the local research environment in Heidelberg. Conclusion. I hope I could show you that BioMed is a powerful new innovation model at this interface between academia and industry. It combines global crowdsourcing with local incubation of the brightest ideas and talents. And the interesting part for me as an entrepreneur is a scalable business model. So it works probably in other locations. We're looking at North America and Israel at the moment, and it works in other technology fields. And of course, what we should not forget is something that Albert Einstein said: creativity is intelligence having fun. And at BioMed, we are bringing top scientists together to have fun doing outstanding translational research. Thank you.